Thank you, Florine, and thank you very much for the opportunity to speak to this webinar, and thank you, eEANO. So my name's Dianne Legge, and these are my affiliations. I'm involved with the Olivia Newton-John Cancer Centre at the Austin Health in Heidelberg, Victoria, Australia, also La Trobe University, and I'm currently a PhD student or a candidate with Curtin University, and involved as an investigator with the Brain Survivorship Project in Australia. So I'm going to talk a little bit about my journey into brain cancer care coordination. So it's a little bit unusual, I suppose, as an occupational therapist. I trained at a time where purposeful action and the maximising of potential and meaning making were really part of the way I trained, and my experience over that period of time was really born in ABI. I also worked in mental health for quite a period of time. So I really came to this role in care coordination as a generalist, really specialising in that chronic catastrophic injury that was either from some sort of neurological incident or work-related injury. So other things that I did to sort of bring me to Neuro-Oncology was I also worked in a number of home-based organisations. So where that sort of collaboration with patients and families was really intrinsic to the way you operated when you actually worked within people's homes. So I guess as a personal perspective, I bring a sense of curiosity and collaboration. And at the time that I trained, and I guess through my working life, I've really having yourself as part of the intervention was a really important part of the way I trained. And so working with patients to help them, encourage them to be their own best expert was actually a really important part of that. So about 14 years ago, I had the opportunity to step into a brain cancer care coordination role. So this, in Australia, this would normally be filled, it's largely filled by nursing, but 14 years ago, there was not a lot of brain cancer care coordination going on. So this was a new role, and it ended up being developed through a philanthropic partnership with a construction union, actually. And they have had an ongoing commitment to the support of brain tumour and patients and brain cancer patients, and they were very committed to developing a sense of family support and patient support that they saw wasn't available when one of their leaders was diagnosed with a glioblastoma. So that's how it developed, and we've had an ongoing partnership with the Cummins Fund for now 15 years. So my role in brain cancer care really forms 4 pillars, and we've really used those pillars as how we've developed the service. So it's around information, resources, support, and acknowledgement. So the information is really that classic patient navigation, targeted, timed information, not overwhelming people. So our service, the Brain Tumour Support Service, is involved from diagnosis. So we go with the oncology team to talk to the patients just after they've had neurosurgery about their diagnosis. Gives me a chance, or us a chance, to meet the patients, meet the families, to begin to develop that connection with them. So then we can arrange sort of that targeted timed information, and that we can begin to get an understanding of what their needs are, and to be able to look in that sort of beyond treatment time to how they go on to live with this illness. I'll talk a little bit about building the bridge to Life with Brain Cancer, which is a resource that our service developed with a survivorship grant from the Victorian government, and that's an online resource as well as a hard copy resource that it really focuses on getting on with life post-treatment. So resources, we, I guess, really try to have our education programs that will build people's personal resource, a little bit like some of the other speakers have already talked about, that sense of people needing to have a certain amount of strategies in their toolkit in order to be able to deal with this the best way possible. We have a range of group programs, particularly focused around fatigue, also memory strategies and compensatory strategies around legal issues, around lifestyle. We also have quite a substantial support group program. And I think the important sense of that is that brain tumour patients and carers, it's important for them to connect with others and people like me. So having the opportunity for people to actually meet with others going through a similar experience is really important, that they can sort of build those self-supporting opportunities. So we run a monthly support group, which is face-to-face, and we've also right through COVID, we had online opportunities. We also run a carers program, which I'll talk a little bit more about in a minute. And then at different times, because we have a bit of flexibility, we can pick up with targeted groups. So for a number of years, we had a sort of an under 30s group, a young people's group. When we had I guess, a critical mass of younger people. At the moment, we've got a young mums group because we have about between just under 20 young women with primary school age or younger children who have been diagnosed with glioblastoma or grade 3 anaplastic astros. So they I guess, sort of getting together online. Acknowledgement is the last sort of pillar, and I guess that really sense of acknowledgement of people needing sort of existential support, that an acknowledgement of that sort of cumulative grief and loss that can go along with the diagnosis, such as brain cancer. Part of our discussion when we see people individually can be around sort of developing some legacy activities. So we do a little bit of that through the support group and also through individual sessions with people. How I bring in the OT, I suppose, as sort of the day-to-day, it's really about that sort of needs identification and navigating to the appropriate service, whether it's rehabilitation or looking at physio, whether people need to go to dietetics, whether they need to go to psychology, but really that sense of promoting independence. Now, in Australia, we have a big new program called the National Disability Insurance Scheme, and that's become quite pivotal for our patients to be able to get appropriate services, particularly in that under 65 age group. So a lot of the care coordinators, and certainly myself being an occupational therapist, I write up plans for the National Disability Insurance Scheme, and that's sort of changed my work role a little bit over the last couple of years, and we certainly assist our patients getting onto that, really with the target of them really having an acquired brain injury. The other two main areas I guess I focus on in terms of being an OT is fatigue, and as I'm sure the other speakers will acknowledge, it's one of the most common issues, and it would be the one thing that I talk to most people about. It's really critical to address. People need a strategy for it. Regardless of what stage they are in their diagnosis and trajectory, it's really important that they can identify triggers, that they have some strategy to build, and that so we either do some individual discussions with people, but we also have a group that we run called the Fatigue Factor, which really works on that self-management, identifying triggers, working out a strategy, trying it out, having a few things in the toolkit to actually use. And I also do a lot of family education, because I think fatigue is something that's not very visible, and I think it can be really misunderstood. I guess very associated with fatigue and that contribute to it is that real cognitive load. And I do a lot of education with people around understanding what an impact, and I call it sensory overload, I suppose, that people with brain tumours, when they're in a busy environment, an example before that Isabel talked about, someone returning to work and being really overwhelmed. So that's what I would talk to people about with regard to them being overloaded in a sensorial way. And that really interrupts people's attention, their memory, their capacity to process information. That can be very difficult for them to then react in a usual way. So it can impact on behaviour and people's ability to communicate. So I often do a lot of patient and family education and really help them develop some strategies around that. And it's very closely interrelated with the fatigue. So that's my kind of quick snapshot of what I do is bringing in the OT. I just want to talk a little bit about caregiver support. As we know, it's a huge burden for caregivers, caring and supporting someone with a brain tumour. Often be high levels of distress, and that they are a really pivotal part of somebody's team. So a lot of what we do is try to definitely engage them very early in the process, really try to give them some space to talk about some of their individual concerns. We do quite a lot of troubleshooting with them. We do have some carer-specific services in Australia, which is great. We sort of talk through strategies about talking to children about cancer. What I found quite a number of years ago is that carers had some really important needs. So we actually pulled together some caregiver groups, and now we run those online, but we in the past we have run them face to face, and I guess we really got together a small group of people and calling it kitchen table wisdom. So that sense of just sharing what it's like to care for someone, what are some common concerns, sharing strategies, sharing ideas, giving caregivers a safe space. From time to time we do have patients, accidentally sort of photobombing the group, which we really try to cut out now, because it's important for the carers to have a really safe space to talk through. And we've found these groups to be really valuable. And I think it really helps with people's preparedness to care. It gives us the chance to provide really honest and open information about disease trajectory, what end of life's like, how you look after yourself, how it's important to self-care as you're going through this. So that's been a great program that we're sort of continuing with. And I suppose that's part of my passion is about improving caregiver resources. So just a sort of a little snapshot of what I've been involved in. So and I'm really passionate about improvements in neuro-oncology support and care. And to this end, 5 years ago, I did my master's study was around understanding how people accommodate low-grade glioma diagnosis, and the learnings from this led to the development of this resource, Building the Bridge to Life with Brain Cancer, which we did as a sort of a co-design collaboration with patients and carers and teams of allied health professionals. I'm involved in the BRAINS program, which is brain cancer rehabilitation assessment and intervention for survivorship needs program, and that's really developing some survivorship interventions and models in Australia. And part of my PhD, which I've just started this year, is really looking at investigating communication and part of what I found in my master's is really the need to investigate the communication, the language of health professionals, and part of my PhD program is really going to be looking at developing and testing communication skills package to use in the brain cancer arena, particularly with respect to carer engagement and also the challenges of cognitive changes with patients. So that's all I've got to talk to. I hope I haven't talked too fast, but happy for questions. And this is just a little snapshot of the resource that we're very proud of. So thank you very much for the opportunity to talk.